Your Royal Highness, Your Excellency, Regional Director, Director General, distinguished ministers and representatives, I am pleased to welcome you this morning to the 69th session of the Regional Committee of the WHO European Region here in the beautiful city of Copenhagen. In my capacity as President of the 68th session of the Regional Committee for Europe, it is my honor to officially open the 69th session. On behalf of all of us, I would like to thank you for this touching performance, which will help us establish a pleasant atmosphere of the session. Hearing children sing is always a good reminder of our main task, to ensure better health for our people for the future. Before turning our full attention to the days ahead of us, allow me to remind you of a few highlights of the last year Regional Committee so that we can build further on them during our debates this year. During the Regional Committee last year, we discussed and endorsed a number of significant policy directions. Let me refresh our mind. We welcomed the participation of high-level dignitaries and decision-makers, building a true intersectoral collaboration for health. In this spirit, RC68 was updated on several key initiatives, such as the implementation of the 2030 Agenda and the review of the Joint Monitoring Framework, and the importance of reporting on the activity related to universal health coverage, equity, health determinants, health literacy, health financing, and dedicated investment for health. The midterm review of the European Vaccine Action Plan 2015-2020 indicated that the region is on track concerning retaining its polio-free status, developing evidence-based recommendations through national independent advisory committees, and financing routine vaccine using domestic funds. However, the region as a whole will not achieve measles and rubella elimination by 2020 and is at risk of falling short of immunization coverage targets. The committee reviewed the outcome of the high-level meeting Health System Response to Non-Communicable Disease and Health System for Prosperity and Solidarity, celebrating the 10th anniversary of the signing of the Tallinn Charter. Member States voiced support for policymakers to invest more in health systems to move towards universal health coverage, and several underlined the pivotal role of primary care in advancing universal health care. We reviewed the European Health Report 2018 and the report Health System Response to Non-Communicable Disease, Time for Ambition, and adopted a resolution on a strategy for men's health and well-being, an action plan to improve public health preparedness or response in the WHO European region, and a 10-point priority action plan to help countries advance public health by upgrading the public health workforce and making health systems environmentally sustainable. The Regional Committee is a real example of political willingness to build consensus, to provide leadership, to enhance the health of the people in our region and globally. I look forward to another regional committee that is as successful as last year and wish all of us good luck to this end. It has been a big honor for me to serve at the WHO. Now it's time to give the floor to Regional Director, Dr. Jakob. Thank you.
Your Royal Highness, Crown Princess of Denmark, Director General, Excellencies, distinguished representatives. It is an honor for me to welcome you to the 69th session of the WHO Regional Committee for Europe. Let me thank the government of Denmark for providing us this environment-conscious and architectural state-of-the-art setting to hold the regional committee in the UN city, a venue that is hosting all the UN agencies in Denmark. It is a particular pleasure for me and honor for me to welcome Mr. Magnus Heunicke, the newly appointed Minister of Health of Denmark, and I warmly thank him for being here with us today, despite having a very busy agenda at the start of his mandate. This year is a particularly important meeting of the Regional Committee, as you will be nominating a new regional director tomorrow. For me, this will be the last one as the regional director, but surely I will never forget this beautiful region which is so close to my heart. Our agenda, ladies and gentlemen, also includes significant technical and administrative matters, and let me just name a few. I am looking forward to your feedback on lessons learned from the Health 2020 implementation in the WHO European region since 2012, and the leadership in public health in the European region. We will discuss the outcome and the follow-up to the Health Equity Conference that we just held in Ljubljana, a follow-up on primary health care, and discuss innovative ways to advance health literacy. We will review the strategic role of the country offices in our region and the work of the European region's geographically dispersed offices, as well as the WHO reform and the transformation which we have implemented during the past years. I would like to thank the member states and partners for their active participation and support in preparing these agenda items, and for your continued support to WHO and our joint work in the region. Welcome to all of you once more, and I wish you a wonderful stay and a very fruitful meeting. Thank you.
Thank you, Dr. Jacob. We shall now move to agenda item 1, the election of the President, Executive President, Deputy Executive President, and Rapporteur. According to the Rule 10 of the Rule of Procedures of the Regional Committee, I shall now submit to you the nomination for the President, Executive President, Deputy Executive President, and Rapporteur. For the office of President, the nomination is Mr. Magnus Heunicke, Minister of Health and Senior Citizen from Denmark. For the office of Executive President, the nomination is Mr. Ioannis Baskotzos from Greece. For the office of Deputy Executive President, the nomination is Mr. Søren Brostrøm from Denmark. And finally, for the office of Rapporteur, the nomination is Dr. Iva Pejnović-Francolić from Croatia. May I seek your agreement to this nomination? Just Moldova. Okay, the delegate of Republic of Moldova, you have the floor.
Thank you, Mr. President. Republic of Moldova wants to announce that fully supports the candidacy of Mr. Magnus Heunicke, Minister of Health and the Elderly of Denmark, for the position of President. Thank you.
Thank you. And the delegate of Slovenia, you have the floor.
Mr. President, distinguished delegates, ladies and gentlemen, Slovenia supports this proposal, and we wish you every success in the work of the 69 Regional Committee. Thank you.
Thank you. So I see that we all agree on the proposal. Thank you. I take this opportunity to congratulate the newly elected officers of the 69th session. I now ask the new elected officers to come to the podium and request to Member States representatives to stay in their place. We shall continue the session immediately. Thank you very much.
Thank you very much. Thank you very much. So, good morning, Your Excellencies, Your Royal Highness, Regional Director, Director General, distinguished ministers, representatives. I am pleased to welcome you this morning to the 69th session of the Regional Committee of the WHO European Region here in the beautiful city of Copenhagen. In my capacity as president of the 68th session, sorry, this was actually my predecessor, so, no, sorry. So, welcome, and great, thank you very much. So, sorry, yeah, great start. It is also a great honor for us to have Her Royal Highness, the Crown Princess of Denmark, patron of WHO Regional Office for Europe, who will now address the Regional Committee. Your Royal Highness, we really appreciate your presence here today, which is a great honor for us. Please, you have the floor.
Minister Heunicke, honourable ministers, distinguished guests, ladies and gentlemen. I'm honoured to once again have the opportunity to speak to you at this, the 69th session of the WHO Regional Committee for Europe. Time goes by quickly, and while preparing for this meeting, I realised just how quickly it does go by, as this is now my 15th year as patron of the WHO Regional Office for Europe. And for 10 of those years, I've had the distinct pleasure of working together with the Regional Director, Dr. Susanna Jakob. Impressive progress has been made in health and well-being across the region over this time. And Health 2020 has proven to be a powerful tool to build political consensus and drive intersectoral action for health. Indeed, Health 2020 has placed the region in an advantageous position to deliver on the 2030 Agenda for Sustainable Development and leave no one behind in health or in life. The time frame the world set of 15 years to reach the Sustainable Development Goals is ambitious, and time, as I have just said, goes very quickly. This year, you will be discussing steps to strengthen health equity, which has the potential to accelerate progress towards health for all and remove unfair, avoidable differences in people's circumstances that places limits on lives and prevents individuals from achieving their full potential. It is unacceptable that babies born in households and neighbourhoods with low levels of resources fail to thrive. It is intolerable that poverty, unsafe homes, social isolation, precarious work, and limited access to quality, affordable health services shorten people's lives. It is a tragedy that exposure to such inequities can shorten a woman's life expectancy by up to 7 years and a men's by up to 15 years. 15 years. So much experience, opportunity, wisdom, laughter, love, cut short. We must improve health equity because, as Professor Marmot says, it is the right thing to do. It is also the smart thing to do because health inequity challenges fiscal sustainability, leads to labour market losses, a reduction to the tax bases, and increasing pension and social welfare costs. And if further arguments were needed, I would add that it is the sustainable thing to do, strengthening Europe's goal of prosperity and peace. Last week in London, WHO launched its European Health Equity Status Report, calling out the policy decisions that compound health inequities, and the 5 risk factors that are holding people back. A key finding that reducing inequities by 50% would produce financial benefits to countries of up to 4.3% of gross domestic product clearly supports the economic case for health equity. The report provides the data and the tools that can guide member states in tackling health inequities and produce visible results in a short time frame. I hope that your discussions in the coming days will also reflect on the experiences and solutions discussed in June at the Ljubljana Conference on Accelerating Progress for Health Equity. The urgency of improving health equity becomes clearer when we recognise that while the European region is on track to achieve the SDGs overall, the lack of progress on reducing health inequities means that we are falling behind on SDG 10, reduced inequalities, and SDG 3, better health and well-being for all. WHO's current programme of work, GPW 13, goes to the heart of the issue, seeking to ensure that 1 billion more people benefit from universal health coverage. This requires intensified efforts to provide accessible primary health care, covering such essential services as immunisation and sexual and reproductive health and rights. Throughout my years as patron, advocating for immunisation has been a priority and a personal conviction. Every child born deserves an equal opportunity to lead a healthy life, and this includes receiving all recommended vaccines. We have safe and effective means to eliminate many diseases, including measles and cervical cancer, thereby preventing suffering from diseases that can permanently alter or take lives. The mere fact that children and adults in the WHO European region are still suffering and dying from measles demonstrates that we need to work differently and do more to reach out to all corners of societies with fact-based information about vaccines and tailored services. With immunisation playing such a key role in achieving 14 of the 17 Sustainable Development Goals, and as a cornerstone of universal health coverage and strong primary health care, it is crucial that we make the necessary investments in expanding access to immunisation in every corner of every community. Across the life course, sexual and reproductive health services delivered and integrated at the primary health care level also have the potential to dramatically improve lives. Yet the inclusion of such services across Europe is uneven and often fragmented. Unmet family planning needs range from 5% to nearly 23% across the region, and are highest among those with low socioeconomic status, migrant populations, and adolescents. In too many instances, there is a failure to deliver quality and comprehensive access to information and services. Countries and health systems that do not prioritise sexual and reproductive health and rights, that do not empower girls or address gender equality, will struggle and likely fail to meet the SDGs. I urge you to intensify efforts to smooth the path towards expanding coverage and providing universal access to sexual and reproductive health services, so girls and women can contribute fully and equally to sustainable development and achieve their own full potential. Poor quality healthcare imposes additional expenditures on households and health systems. The Lancet recently reported that if high-quality health systems were in place in 137 low- and middle-income countries, maternal deaths would decline by half. Ensuring access to quality of care for women, not just during pregnancy and childbirth, but across the life course, will improve the health, well-being, and future of children, families, and countries. Tackling the complexity of sexual and reproductive health and rights in constantly challenging political contexts is far from easy. Yet we have excellent examples of countries in the region that are implementing rights-based approaches, policies, and it is important to learn from these countries and share best practices such as good conditions for parenthood and the efforts made in engaging men in developing the way forward. The WHO Europe Action Plan for Sexual and Reproductive Health is helping to accelerate progress here. In this context, I would like to draw your attention to the fact that 2019 marks the 25th anniversary of the Cairo International Conference on Population and Development, commonly known as the ICPD. The ICPD Programme of Action, endorsed by 179 member states, marked a turning point by putting people's rights and dignity at the very heart of sustainable development. It emphasises that sexual and reproductive health is a fundamental human right and that empowering women and girls is one of the most effective ways to improve well-being for all. In November this year, the governments of Kenya and Denmark, together with UNFPA, are co-convening the Nairobi Summit on ICPD 25, Accelerating the Promise for Progress. This high-level conference seeks to mobilize the political will and financial commitments we urgently need to finally and fully implement the ICPD Programme of Action. These commitments focus on achieving zero unmet need for family planning information and services, zero preventable maternal deaths, and zero sexual and gender-based violence and harmful practices against women and girls. I look forward to seeing many European member states represented in Nairobi. Through implementing Health 2020, improving health equity and the wider conditions that influence health, and building effective integrated primary health care covering immunisation and sexual and reproductive services, I am certain that you will extend universal health coverage, deliver on GPW 13, and speed progress towards achieving the Sustainable Development Goals. Ultimately, this means you will improve lives, hand in hand with the child, young person, woman, or man who risk falling behind. You will enable people in the European region to prosper and thrive. Finally, I cannot conclude today without saying a few words about Dr. Susanne Jacob. It has been a privilege and pleasure to work with her over the past 10 years in advocating for better health for all across the European region. We have travelled widely together, visited many of your countries, listening, learning, and discussing. Our shared aim has been to enhance action for better, more equitable and sustainable health and well-being in Europe and beyond. This has been a truly enriching experience for me, both personally and professionally. Under Susanna's remarkable and inclusive leadership, the European region has made enormous progress, and she has also paved the way for that progress to continue. Thank you for your ceaseless energy, drive, commitment, and care. Dear Susanna, you will be missed. Once again, you have an ambitious agenda ahead of you the coming days, and I wish you all success in your discussions and deliberations. Thank you.
Thank you very much, Your Royal Highness, for sharing your thoughts with us and for your continued support for the WHO activities in the European region. We look forward to continuing working with you. Thank you very much. And before moving to the adoption of the agenda and the program of our meeting, I wish to make a few important announcements on the organization of our work at this regional committee session concerning the nomination of the next regional director under agenda item 6, letter A. First of all, I would like to inform you that the following candidates for the post of the regional director wish to attend our meeting. Dr. Clemens Martin Auer, proposed by Austria. Dr. Nedret Irimoglu, proposed by Turkey. Dr. Tatul Hakubayan, proposed by Armenia. Dr. Hans Kluge, proposed by Belgium. Dr. Natale Menabde, proposed by Georgia. And I am pleased to welcome them on your behalf. Secondly, I would like to underline that the Code of Conduct for the election of the Regional Director of the World Health Organization Regional Office for Europe makes it clear that the member states and candidates should encourage and promote communication and cooperation among one another during the entire election process, and that they should act in good faith, bearing in mind the shared objectives and promoting equity, openness, transparency, and fairness throughout the election process. Accordingly, campaign events may be organized either by member states or by candidates in the margins of the meeting when the meeting is not in official session. It is not anticipated that campaigning will take place as part of the official program of the meeting, and accordingly neither member states nor candidates will be giving speaking time during official meetings to promote a candidacy. Delegates are asked to respect this when making interventions on matters on the agenda. Please refrain from doing so when addressing the meeting. Thank you very much. In order to ensure that our meeting during this session leading up to tomorrow's morning's private meeting is conducted efficiently and we are able to concentrate on our otherwise heavy agenda, I would like to obtain the committee's agreement that no promotional material relating to the candidates be distributed by delegations in this meeting room. As you may have seen, stands have been made available for the candidates to display their campaigning materials if they wish to do so. And lastly, we would like to urge delegations not to arrange bilateral meetings during the RC69 official sessions. Is that agreeable to everyone? I see no objections, so it is so decided. I would ask all persons in this room to kindly confirm once more that they have switched their mobile phones to vibrate or meeting mode. And I would like to take this opportunity to remind you that Rule 3 of the Regional Committee's Rule of Procedure requests the member states of the region to provide credentials already before the opening of the meeting. Credentials are reviewed by the Committee on Credentials appointed by the SCRC at its 5th meeting. This year, in particular, the Credentials Committee plays a significant reviewing role. Delegations are therefore kindly reminded to hand in the original versions of their credentials to the Secretariat. If you have not already done so, please take your original credentials to the registration desk at your soonest possible convenience. The first meeting of the Committee on Credentials is planned today during the afternoon coffee break in Office 0.2.07. If necessary, the committee will reconvene on Tuesday morning at 8:30 in the same office. So, this said, now we shall turn to agenda items. Adoption of the provisional agenda and program of work for this session contained in documents EUR/RC69/2 and EUR/RC69/3, respectively. I would like to know if there are any proposals for items to be included under agenda item Other Matters. I see none. Is the Regional Committee therefore ready to adopt the agenda? There we are. As I see no objection, the agenda is therefore adopted. Regarding our program of work, this session of the Regional Committee will last for 4 full days and will close on Thursday, the 19th of September, around 5:30. As you know, the final program and annotated agenda were published on the official website and app on Friday afternoon. I want to draw your attention to 2 important points here. The address by the Director General will be held this morning, before the address of the Regional Director. As you know, normally the Director General's speech is on Tuesday morning. However, in an effort to align the work at the regional and global level, and we all agree that this is very important, the Director General's speech is now in the opening sessions, followed by the address of the Regional Director. After the address of the Regional Director after the Regional Director address, I will open the floor for your interventions to both the Director General and Regional Director. We will allow sufficient time to do this, and I will give Member States more than the normal 3 minutes to address both the Director General and the Regional Director in their interventions. The private meeting on agenda item 6 on elections and nominations is scheduled for Tuesday at 9 o'clock, Tuesday morning. During this private meeting, the committee will nominate the new regional director to be appointed by the Executive Board in February 2020. After that important decision, we will also nominate and elect the candidates for the Executive Board and the Standing Committee, respectively. In this regard, the Standing Committee of the Regional Committee will distribute, under confidential envelope to the heads of delegation, its proposed shortlist of candidates for the seats to be filled on the Executive Board and the Standing Committee for your consideration. Concerning the attendance of the private meeting, I would like to inform that only representatives of members, their alternates and their advisors, and essential members of the Secretariat are allowed to attend. Candidates should not be present in the room during consideration of item 6, irrespective of their capacity in which they attend this session of the Regional Committee. In relation to the voting, I would like to remind delegates of Rule 24 of Rules of Procedures of the Regional Committee, which states that only member state representatives and their alternates have the right to vote. Similar to previous years, we will not approve the report of the meeting at the end of our session, but a draft report will be posted on the Regional Committee website with a deadline for comments prior to its finalization. As President of this Regional Committee, I will draw the final reports of the meeting to prepare my report to the Executive Board in February 2020. This report will give special attention to the Regional Committee discussions of importance, to the global governing body agenda, in particular on the topics discussed during matters arising from the World Health Assembly later this week. But it will, of course, also include the central deliberations on our regional work as well. With this clarification, I would like to ask for your agreement on the provisional program for this session of the Regional Committee as outlined in documents EUR/RC69/3.
Finland is asking for it. But first we have to adopt the program.
Okay.
And then we go back to Finland
Okay.
because they did not raise the floor on time.
Okay. Okay, I see we all agree on the proposed program, but I can see Finland has asked for the floor. Finland.
Mr. President of the Regional Committee, Your Royal Highness Princess Mary, Director General, Regional Director, Excellencies, dear delegates. I'm speaking on behalf of the European Union and its member states. The European Union works closely with the World Health Organization on the wide range of subjects, both within the European region and on global level. As agreed in the exchange of letters of 2000 between the WHO and the European Commission concerning the consolidation of intensification of cooperation and without prejudice to any further conclusion of the general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Regional Committee as observer. As in previous sessions, we ask the Regional Committee to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberation of the meetings of its committees and subcommittees, drafting groups, or other subdivisions thereof addressing matters falling within Union competence in the 69th session of the Regional Committee for Europe. Thank you.
Thank you. Is there any objection to this proposal? I see none. So it is therefore accepted. Moving on, I should inform you that all documents for the session are available on the regional office website, and we hope to work in an as environmental friendly way as possible. The Secretariat has developed an app that also includes the meeting documents and allows you to interact actively. Please contact the information desk if you have any query about the app. For this year's Regional Committee, we also will pay special attention to our physical activity. You are invited to participate in the Move for the 3 Billions campaign, which you can find in the Healthy Meetings section of the app, and we will also do some physical activity during our meeting. Let me also briefly inform you of the many side events during this Regional Committee session. Today and tomorrow, there will be a lunch meeting for ministers or head of delegations only. Today, during the ministerial lunch, the ministers and heads of delegations will discuss the issue of leadership in public health in the WHO European region. Tomorrow, ministerial lunch will be threefold. It will mark the launch of the publication Better Health for Europe, More Equitable and Sustainable, which is in fact a reflection of the regional director's 10-year mandate. Also, during this ministerial lunch, the regional director will award European personalities who contributed to the improvement of health in our region. And lastly, during Tuesday's ministerial lunch, we will mark together the first World Patient Safety Day, which will be celebrated from tomorrow on each year on the 17th of September. During the ministerial lunches, interpretation will be provided in all 4 languages. There will be 4 technical briefings during the lunch breaks, open to all delegates. Today, technical briefing will be on the digitalization of health systems. Tomorrow's briefing will be on health diplomacy and migration. Wednesday, on the collaboration at the regional level with European parliamentarians. Finally, on Thursday, there will be a briefing on children's and adolescents' health. And all technical briefings will have English and Russian interpretation. Finally, I wish briefly to mention a few practical matters to facilitate our proceedings. It would be appreciated if delegates wishing to speak would kindly raise their nameplates and, when speaking, start by stating their names and those of their countries. With just 4 working days at our disposal, I would ask you to keep your interventions short and to the point so that we can complete our discussions on time. Please limit your interventions and comments to 3 minutes. To ensure that everyone wishing to speak gets the chance to do so, a traffic light system will be operated this year. So I would like to invite the representatives of the non-state actors organizations who wish to speak or deliver written statements to inform the Secretariat through the information desk situated in the lobby. This will facilitate the coordination of interventions. In line with Rule 22 bis of the Rule of Procedures of the Regional Committee, Member States may hand in written formal proposals for new resolutions or decisions to the Regional Director. The Secretariat has not received any such new proposals. Additionally, in line with Rule 22-ter, substantive amendments to those resolutions or decisions should be handed to the Regional Director prior to the opening of the first day of the session of the Regional Committee. The Secretariat has received amendments from Kazakhstan, Norway, and the European Union, has taken them into account and prepared new versions for the RC. These revisited versions are available on the website and in hard copy. If you wish to have copies of documents or need to send a note during the session, please raise one of the blue papers, those ones, and one of the conference assistants will immediately assist you. If there are any questions about the procedures or needs for clarification, I shall be happy to respond. For security reasons, badges should be worn at all times, including during the official social events. A group photograph will be taken during the first coffee break today. The Secretariat will guide us through that. And finally, please be aware that the plenary sessions are being web-streamed and can be viewed on the RC69 section of the Regional Office website. In addition, photographs taken during the session may be used in future publications and electronically on the Regional Office website. with this, we can now move to our next agenda, item 2B, address by the Director General, Dr. Tedros. I am very happy to welcome you wholeheartedly to our regional committee. We are very pleased that you are with us. A lot has happened since you were with us last year, and we are eager to listen to you on the opportunities and challenges ahead. It is my honor to invite you to address the committee.
Tack ska du ha, Mr. President. May I go?
Yeah.
Yes, yes.
In 1988, that's why I said to Mr. President, tack ska du ha. Your Royal Highness, Crown Princess Mary, Mr. Magnus Heineke, President of the 69th session, Mr. Ioannis Baskosos, Executive President, Dr. Susanna Jacob, Regional Director, Honorable Ministers, distinguished heads of delegation, and also Professor Ola Rosling is with us, dear colleagues and friends. God morgen. That's another word from 30 years ago. I'm really delighted to be back in Copenhagen, a city with which I have a deep personal connection and very fond memories. Actually, Copenhagen shaped me to believe in universal health coverage. This is a city or a country for the first time I had health insurance in my life. That was at age 23. And then I was very curious because I was here for 4 months, but I got a health insurance for 1 year. Then I was really curious because, okay, if they're covering their guests, then what does the health system look like to the Danes or to their citizens? And I found out that every Dane was covered. Every Danish was covered. And I saw the success of universal health coverage in this country. And that influenced me until now. And that's why I'm a very strong advocate of UHC. But not only Denmark, I also visited, of course, I did my master's in the UK 3 years after that, in 1991. And I saw the NHS firsthand. And I was also surprised to see, even to understand when NHS started in the UK, which was immediately after the World War, after the Second World War, when the UK's economy was actually in its knees. And that was a big lesson because you can start UHC even when your economy is in tatters. That was a big lesson for me too, and reinforced my belief that I had in Denmark to be reinforced in the UK. And of course, afterwards, as part of my PhD, I studied in Sweden, then another, again, opportunity to see how universal health coverage works and reinforcing my belief that UHC is central. But in Denmark, as I said, I have even more memories. That's when I learned they had more than double bicycles than the cars, and a separate lane for bicycles. By the way, that was my first experience. And the concept of healthy city, and so on, and so on. So thank you so much for that, Denmark, for influencing me and for being what I am, and of course, the countries I have that I subsequently did my education and was influenced and became a believer of universal health coverage. The reason I'm stressing on this is, as you know, this year is when, in just next week actually, we will be discussing in the UN General Assembly on UHC. That's the high-level meeting. And that's a very important week, and I hope all of you will give your contributions for the success of this high-level meeting. And I thank the Royal Highness for your support to WHO, your leadership in health, and for your inspiring remarks this morning. Please accept my deepest thanks and respect and appreciation. I'm also delighted to be here for my sister Susanna's last regional committee meeting as regional director. Under her leadership, the region has made great progress over the past decade. As a key part of the region's work over the past 10 years has been Health 2020, the policy framework adopted by member states to improve health outcomes and reduce health inequities. There are many successes to celebrate, as you know. Life expectancy in this region is increasing, and the gaps in life expectancy between countries and between men and women are narrowing. Infant and maternal mortality have both fallen. Premature mortality from non-communicable diseases is declining, and you're on track to reach the SDG target. This is very impressive. You're setting an example for the world, and you should be proud. Most countries now have a policy or strategy to address the determinants of health and inequalities in health. The regional office has also been at the forefront of efforts to address the health of refugees and migrants and to deal with the threat of antimicrobial resistance. We should celebrate these achievements, and yet significant challenges remain for the next regional director and for you as member states. There are still large inequities within and between countries. For example, there is more than 10-year gap between the countries with the shortest and longest life expectancies. Tobacco use remains unacceptably high, and alcohol consumption is the highest in the world. Overweight and obesity are rising. Out-of-pocket health spending accounts for more than 30% of total health spending in more than 20 countries, due largely to the cost of medicines. Vaccination rates are high across the region, but again with significant variation. Because of low coverage nationally or in pockets within countries, measles outbreaks are spreading rapidly. Globally, the number of reported measles cases doubled last year from 2017, and the number of cases so far this year is already more than any year since 2006. As you know, 4 European member states recently lost their measles-free status. This is not acceptable. The vaccination summit in Brussels last week was a timely opportunity to revitalize commitment for closing these gaps. Once again, Your Royal Highness, we thank you for your invaluable support for immunization. Health 2020 expires next year, but its goals are well aligned with both the Sustainable Development Goals and WHO's General Program of Work. As you know, the catch cry of the SDGs is to leave no one behind. We cannot tolerate a world or a region where the rich get healthy and the poor get sick. We're committed to health for all, not health for some. The resolution before you on accelerating progress towards equity is therefore central to our mission. Equity. Strong leadership in public health to reach our $3 billion targets will also require your continued political commitment. The health challenges you're facing have one thing in common: they all require a response that goes beyond the health sector. Very often, by the time people present at our clinics and hospitals, the damage has been done. To achieve a healthier Europe, we must go beyond the health sector to address the root causes of disease in the air we breathe, the food we eat, the water we drink, and the conditions in which we live. That's a key focus for WHO as part of our transformation and the healthy populations pillar we have established. No country can afford simply to sit back and treat the effects of tobacco use, harmful alcohol consumption, and unvaccinated children. We must be relentless in our efforts to promote health and prevent disease. This is the unfinished business of Health 2020, and you have to continue this work with determination, attacking at the root cause of the problem. We cannot continue to manage diseases. We have to promote health. Within the region, the regional collaboration for health with parliaments is especially important. At the Interparliamentary Union meeting in Serbia next month, we're expecting a resolution on universal health coverage to pass. We have been working with the International Parliamentary Union. Harnessing the support of parliaments is vital for creating the regulatory and policy environment for health. In Astana last year, the world came together to recommit to primary health care at the foundation of universal health coverage. The high-level meeting on universal health coverage at the UN General Assembly next week will echo that call. Secondary and tertiary health services, as you know, are of course an important part of every health system. But the more we can prevent or delay the need for them, the better. That's why primary health care is central. The agenda item on accelerating progress on primary health care is an excellent step towards translating political commitment into concrete policy ideas. The 10 policy accelerators cover a wide range of evidence-based interventions that can improve the performance of health systems and health outcomes. I'm very pleased to see that each of them also comes with specific digital pointers for using modern technologies to implement the accelerators. Digital health is a key focus for WHO as part of our transformation, and we're glad that we're aligned on that. We all know that the future of health is digital, and we want WHO to be ahead of the curve to contribute to global health, especially digital health. Artificial intelligence and digital technologies are changing the way healthcare is delivered right across the continuum of care. And WHO has a unique role to play in advising countries on how to maximize the opportunities of digital technologies while avoiding the pitfalls with appropriate regulation. That's why WHO has created a new Department of Digital Health to enhance our role in assessing digital technologies and support countries to make decisions about how to prioritize, integrate, and regulate them. Harnessing the power of digital technologies for health is vitally important. But the best asset we have for improving the health of people is people. People may only interact with the health system rarely, but every day they make many decisions that affect their health in small ways. We must empower people to become active participants in their own health, rather than simply passive recipients. Progress can be made on many of the health challenges you're facing. Tobacco and alcohol use and vaccination, for example, by arming people with the information they need to make healthy choices. The European roadmap for implementation of health literacy is an excellent first step. And I look forward to seeing the action plan to be developed in the next phase. And I commend you for this. But member states don't need a roadmap or an action plan to take action. The roadmap includes several examples of countries that have taken the initiative to improve health literacy. WHO stands ready to work with all member states to develop and implement initiatives that put people in charge of their own health. It has to be people-centered. Your Royal Highness, Excellencies, colleagues, and friends, WHO is committed to a healthier, safer, and more equitable Europe. And we're committed to becoming an organization you need us to be. Since we last met 12 months ago, the regional directors and I have been hard at work transforming WHO into an agile organization that works seamlessly across all three levels to deliver the Sustainable Development Goals. By the way, that's why I poached Susanna from here. And some people say that's actually the best catch. And you know, I will talk about it later. We now have a new program budget to support the general program of work. To build this new budget, we turned our planning process upside down so that country needs drive the work of headquarters and the regions. For the first time in our history, all three levels of the organization have worked together to define exactly what headquarters will produce in the coming biennium. As a result, we now have a list of more than 300 specific global public health goods, the technical tools you need to make progress towards the 3 billion targets. All this came from the grassroots. But we're not just changing what we do. We're also changing how we do it. Our new operating model aligns the organization at all three levels and will enable us to work together more effectively and efficiently. We're planning together how we can best support country priorities. We're working hard to make the organization result-oriented and to achieve these results, particularly at the country level. One of our key priorities was to make sure every single WHO employee can connect their work to the corporate priorities. Today, 75% of staff can link their day-to-day work to the general program of work, compared with only 47% at the start of this year. We're also committed to increasing diversity across the organization. We have already achieved several quick wins. We have started rolling out certain new or redesigned processes to harmonize and optimize the way we do business, from the way we develop norms and standards to planning, monitoring implementation, and results, recruitment, procurement, communications, and more. And we have announced plans for the WHO Academy, a major initiative to revolutionize health learning globally and train health workers to implement WHO norms and standards. The Academy, we believe, will be a game changer in global health. The agreement for the establishment was signed with His Excellency President Macron, and the Academy will be based in Lyon. Excellencies, colleagues, and friends, I leave you with 3 challenges for the next year. First, address the root cause of disease. Our job as public health professionals is not simply to run a health system. It's to build nations and communities in which health can flourish. For that, we must engage actively with colleagues in finance, trade, agriculture, energy, transport, industry, and more. We need to address the root causes and promote health. We shouldn't continue to manage diseases. Second, commit to strengthening health literacy. As I said, our best asset for protecting the health of people is people. And in that, you're in the right direction. When they have accurate, reliable information, people can be empowered to make decisions that protect their own health and that for their families and communities. Third, prioritize primary health care. Most of the challenges you're facing must be addressed at the primary level. Primary health care is where health is promoted and diseases are prevented. When everyone in a population has access to quality primary health care services, inequalities are reduced and outcomes are improved. As the Astana Declaration affirms, primary health care is the foundation of achieving universal health coverage. The high-level meeting on universal health coverage in New York next week is a vital opportunity to catalyze political commitment for primary health care. We look forward to having the support of as many of your heads of states and heads of government as possible. Finally, my sister Susanna, congratulations on 10 years of serving the people of Europe. You have much to be proud of, and you have left the regional office in good shape for your successor. I very much enjoyed working with you in the Global Policy Group, and I'm delighted to be working with you now in your new role as Deputy Director General, as my Deputy Director General. Europe's loss is the world's gain. So when the world gains, I think Europe will be happy. So I also know that the member states shaped Susanna for what she is. So thank you so much for making her what she is, because that's also what she believes, because it's both ways. She contributed, you contributed to what she is now. And thank you to have the best coach to help me push the global agenda. And I look forward to working with the next regional director. They have a hard act to follow. My brothers and sisters, thank you for your commitment and support. I wish you a very productive meeting as we work together to promote health, keep the world safe, and serve the vulnerable. Thank you so much. Vielen Dank. Merci beaucoup. Spasiba. Tak shkaduhe. And so on. Thank you so much. I think I forgot. Muchas gracias. Thank you.
Thank you, Dr. Tedros. As you know, our region is very committed to global health and to WHO in its leading and coordinating role. And as I said earlier, there will be an opportunity to do this after the address of the regional director.